Our next session is what I like to think of as our time to start really rolling up our sleeves and getting focused on action and policy change. We'll hear from local leaders about the prizes that they have their eyes on. And to moderate the session for us, it's my pleasure to introduce Faith Battles, the Assistant Agency Director for Adult and Aging Services for Alameda County Social Services Agency. I have the pleasure of serving on the Age Friendly Council with Faith. And Faith, I'm very happy to hand the floor to you.
Thank you, Wendy. Okay, so here's an opportunity for us to get a little bit more kind of quick glances at what folks are looking forward to in their work. So we've heard about how public policy will define the landscape of aging services this year. And we have a good idea about how the pandemic and the economy is going to impact everybody that's living here in the county, specifically our seniors. So now it's time for us to settle in and get practical. We've asked a few local leaders to share their prizes, the policy or system changes that they believe will have significant impacts for the older adults right here in Alameda County. So we want to make sure you still stay engaged. So keep answering any questions you may have. We want to be able to do that. So write your questions right down there in the box, the chat box. We'll make sure we capture all of them, and we'll see if we can answer them for you going forward. So the first 4 prize speakers that we have recorded their prize statements because they couldn't be here with us today. So first up, we're going to hear from Nicole Howell. She's the Executive Director of Ombudsman Services of Solano, Contra Costa, and Alameda County.
Hey everybody, my name is Nicole Howell, and I'm the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda. And that's a long way of saying that my team and I work in long-term care and advocate on behalf of those who live there. And there's one thing that we're passionate about. It's about improving care for residents. And my prize is calling for a statewide investment of $5 million to expand the healthcare career pathway. This is an innovative program that allows students with addressable barriers like history of homelessness, addiction, maybe first in their family to enter the post-secondary education, to enter the allied healthcare field as certified nursing assistants with a comprehensive, student-centered, person-driven curriculum anchored in restorative justice practices. These allow students who maybe haven't always had the easiest life to enter the allied healthcare field, and we desperately need more team members who are in that field, and care for residents in a way that is person-centered, is equitable, and is an eye towards who residents really are. You can learn more about this program by checking out the Master Plan on Aging local playbook under Goal 4, slide 34. And I'm going to attach some additional information about how it's played out here in Contra Costa County, where it's founded. We have some evaluation reports, we have some labor market data, and we also have some testimonials from our students. So I hope you learn more about it, and I hope you'll join me in my quest for a $5 million statewide investment to expand the healthcare career pathway and allow it to be a statewide program. Wishing you all well, and I wish I could be there with you today.
This is a really, really good prize that Nicole has called out. Healthcare services in general are in very great need of employees, and getting young people attracted to that, especially that come from impacted backgrounds, is fantastic. Our next speaker is Cynthia Carter Perrilliat, co-founder and executive director of Alameda County. I can't see. There you go, Alliance Collaborative. Take it away.
Good morning. I'm Cynthia Carter Perrilliat, co-founder and executive director of the Alameda County Care Alliance Collaborative. The work of the ACCA is to hire and train community care navigators to provide support, resources, and empowerment to persons dealing with advanced illness and their precious caregivers. Our prize is a deep and impactful partnership with health plans and health systems so that members can access free support services that we provide, addressing social needs like transportation, food assistance, housing, and don't forget advanced care planning that aligns with what our seniors really want. Their spiritual and caregiving support needs driven by their own personalized advanced illness care plan. We are thrilled to begin this work with our first healthcare system partner, Kaiser Permanente Oakland, next month. Kaiser Permanente Community Benefits has been a funder for the ACCA since our inception in 2014. So what we need is assistance in identifying other health plans and/or health systems that recognize the need for bridging the gaps, addressing disparities, and advancing equity in and for communities of color and our underserved community members. Thank you so very much.
Advanced healthcare planning has never been more important than it is right now. It's a very difficult topic to consider, to have discussions about with our loved ones, or even for us to consider. So that's a really, really good prize. Next up, we have Dr. Jim Mittelberger. He's the interim CEO and CMO of Centers for Elders Independence.
Hi, I'm Dr. Jim Mittelberger, the interim Chief Executive Officer and Chief Medical Officer for the Center for Elders Independence. Currently, the system for resources for vulnerable elders in our communities is so complex that many fall into the cracks. Medical care is separated from social care. Multiple resources are poorly organized and are separated into a confusing set of silos. PACE is the program for all-encompassing care of the elderly. It's an extraordinary benefit for health and social care in one system for frail elders. PACE allows for a comprehensive care plan with an array of services and covers even transportation and social events. It keeps people in their homes and in the community. My system change would integrate PACE assessment and referral into the current intake and assessment processes used by Alameda County's AC3, by nurse case managers in public health, information assistance workers in adult and aging and other county agencies, and by Alameda Health Systems. This would ensure that every frail elder would get the information they need to choose the best health and social care benefit for them. If everyone understands their options, I think more would choose and would benefit from PACE. Thank you.
Very nice. Thank you. And last for our video pre-recorded prize statements is Corinne Jan, the CEO of Family Bridges.
Hi, it's Corinne Jan, the CEO from Family Bridges. The prize I seek is not original or recent, but still elusive because of discriminatory and racist roots. The prize would be a successful legal challenge to the Trump administration's August 2020 rule, which eliminated translated notice and tagline requirements on significant communications from Medicare and other healthcare services. Not only does this rule prevent limited English proficient clients' access to services, but further distances them from understanding their rights to free language services. Our distinguished colleagues at Justice and Aging are seeking plaintiffs to bring legal action to reverse this rule. Our immediate tasks should be to seek plaintiffs to this end and continue to promote long-term justice seen in equal access to health care for all older adults. And perhaps what we can do now is to get this to the forefront of attention to the Biden administration. To help us get the prize, please contact Denny Chan at Justice and Aging. Thank you.
Thank you.
And just to let you know, Faith, that Margaretta wasn't able to join us, so she was able to send us her video. So we have one more.
Okay. Margaretta Lynn with Executive Director for Just Cities.
Morning, everyone, and hello. I'm Margaretta Lynn, the Executive Director of Just Cities, a racial justice public policy organization. My prize would be for the Alameda County Board of Supervisors to enact a North Star fair chance housing policy modeled after the work we did in the cities of Oakland and Berkeley in 2020. This would address the triplet pandemics of mass incarceration, homelessness, and COVID that many of our low-income older adults with criminal records are currently confronting. Let's get this done in 2021. Thank you very much.
Thank you. All right, so now we have several individuals that are prize speakers that will be present for us to be able to hear directly from them. And Wendy, are you about to say something?
No, I'm good. You can go ahead. And just a note to Danielle, put us in, let's stop spotlighting Faith and let's put us in gallery mode so that we can see everyone as they pop up. And we get to hear from the next prize speakers live, right, Faith?
Right. Are we ready now?
Yes.
Okay, very good. First up for our prize speaker is Alexandra Boskovich. She's with the Alameda County Community Food Bank. Alexandra, your turn.
Thank you so much, Director Battles, and good morning, happy Friday. My name is Alex Boskovich, and I'm the Government Relations Manager for Alameda County Community Food Bank, and also a proud steering committee member of the Senior Services Coalition of Alameda County. So my 2021 first prize is the passage of State Senate Bill 107, authored by Senator Scott Wiener. This very common sense legislation would simplify the CalFresh application for older adults and people living with disabilities and make it easier to complete the CalFresh application in other forms by phone. It is no secret that the pandemic is severely impacting older adults and people living with disabilities, both in terms of infections and access to food. We see that every day at the food bank. We need CalFresh, our country's most direct and effective anti-hunger program, now more than ever. But because the process of enrolling in CalFresh is far more complicated than it has to be, only a fraction of older adults who qualify are actually able to take advantage of its benefits. In fact, California has the lowest CalFresh enrollment rate among eligible older adults than any other state in this country. So by creating a simpler, shorter application and making it easier to apply over the phone, Senate Bill 107 will take us one step closer to a more equitable CalFresh program that is inclusive to all who need it. So please join the food bank in supporting this urgently needed and long overdue policy change.
Thank you, Alex. Next up, we have Wendy Peterson, Senior Services Coalition. You all know her very well. Wendy, what would you say?
Thank you so much. And of course, you know, I'm the one running the slides, so I'm the one who's not prepared. So I have two prizes. One of them is to extend the Adult Protective Services Home Safe program beyond the sunset date of June 2021, and to invest an additional $10 million in new state general funds over 2 years so that elders who are facing homelessness as a result of abuse will have the support that they need to stay safely housed. My second prize is to promote digital inclusion and connections to technology for seniors and other low-income communities by expanding existing programs to extend broadband connectivity to affordable housing and publicly subsidized housing communities, following the governor's August 2020 executive order.
Very good, thank you, Wendy. Next up, we have Marty Lynch, Lifelong Medical Care. What would you say, Marty?
Sure, thank you very much. Marty Lynch from Lifelong. As you know, we're a federally qualified health center that provides health to older people and homeless elders and many others. I would call out two things. I spent a lot of the past year working on the master plan on aging. So I want to call out two things at the state level that I think will have an impact on all of us, both immediately and then longer range as well. The first one is the master plan recommends establishing a Medicare Innovation and Integration Office at the state. And you might ask why Medicare? The state doesn't do Medicare. But it's because it's so important to coordinate care for the dually Medicare and Medi-Cal eligible folks who are typically the least healthy and the poorest folks in our population. and at the same time, take advantage of Medicare chronic care services for people that are only on Medicare and make sure we leverage that opportunity that's now available. And remember that you can be Medicare only and be 200% of the federal poverty level, which is plenty poor in the Bay Area for sure. So that establishment of an office is one thing that's going to work with Medicare. Number two, the master plan gives a nod to a long-term services and supports coverage program in the long range, working with the feds. I think we have to see the legislature take a specific step this year to move that along. So I'd like to advocate, have us all advocate for that, so that eventually we do have first dollar long-term services and supports insurance coverage that's paid for by a payroll tax, and that's the first dollar to bridge between onset of disability and future use of maybe Medi-Cal or private coverage. So those are the two things, the LTSS coverage step and the Medicare Office of Innovation and Integration. Thank you.
You're very welcome. Thank you, Marty. Next up, we have Claire Ramsey, Justice and Aging. What do you say?
Hi, thanks, Director Battles, and thanks, everyone. I'm Claire Ramsey, and I'm a senior staff attorney at Justice and Aging. My two prizes for 2021 are expanding Medi-Cal to undocumented older adults 65 and over, and increasing the Medi-Cal asset limit. Both these actions will help ensure older adults, especially immigrants and people of color, have equitable access to Medi-Cal. Having comprehensive free health insurance and access to home and community-based services could not be more critical during the pandemic and beyond. We ask for your support of SB 56, authored by Senator Durazo, which will expand access to Medi-Cal for undocumented seniors, and for support for Assemblymember Carrillo's bill, which doesn't have a bill number yet, but will soon, to increase the Medi-Cal asset limit. Both of these may also be budget items, and we need strong support to make sure people have the health care they need. And I'm going to add one more thing. We actually have an informational hearing on increasing the Medi-Cal asset limit on Tuesday, February 2nd. So I'll put the information about that hearing into the chat. And we just need to hear the voices of people who would be served by not having such a tight Medi-Cal asset limit, which is right now $2,000 for an individual. So thank you, and great to be here with you all today.
Thank you, Ms. Claire. And last but not least, we have Sharon Cornu with St. Mary's Center. Sharon, what do you have to say today?
Hi, I'm Sharon Cornu from St. Mary's Center, and my eyes are on the prize of Measure W funding to provide services to our unhoused neighbors and prevent homelessness. We know that seniors are the fastest growing segment of the unhoused population and part of families and communities deeply impacted by homelessness and housing insecurity. First, gratitude to the community that came together despite the pandemic to encourage our county supervisors to put it on the ballot and engage with voters to pass it. If you followed it, it was a squeaker. Now we have the bigger responsibility of making sure that the money is targeted the right way at the right time and focused on needs that reflect the experience of people with critical insights, people with lived experience of homelessness and worked experience of providing services. We'll need to come together to keep our collective eyes on the prize, to protect these funds and build a movement to speak truth to power. Thank you.
You're very welcome. I really enjoyed that. Super interesting. And I like your phrasing, Ms. Sharon, keep your eyes on the prize. That's a really good way to track what's happening and all the interesting things that are coming.